Halocephalus gingivalis is a small, free-living rabbitoid nematode that is facultatively parasitic. It is the only species in the genus to affect vertebrates. It most commonly, but rarely, infects both humans and horses. This parasite is also neurotropic, which means it has an affinity for nerve tissue. It also infects the kidney, mouth, and nose. Its life cycle, mode of infection, and risk factors are poorly understood. Some common symptoms are listed here: vasculitis, granulomas, and meningoencephalitis. There's unfortunately lack of appropriate screening tests, so a lot of the diagnosis has to be done post-mortem. The image on the left shows the larval stages of the nematode, and the image on the right shows the adult stages. Two main cases are very rare, and they're always fatal. The most common infection route is through cuts and lesions on the skin. Listed on the slide are the three first cases that we learned about in lecture. In 2010, a fourth case came to light. A 39-year-old woman who presented meningeal signs, altered mental status, and a rash had diagnostics done via an open brain biopsy, and they found granulomatous vasculitis. Unfortunately, she later died, and an autopsy later revealed larval forms and mature nematodes in her brain. Another case occurred in 2013 when a 65-year-old Caucasian woman from Pensacola, Florida started with a UTI, the nausea, vomiting, the onset of anemia, blurred vision, and tenderness in the left temporal area of her brain. She also had a pulmonary edema causing respiratory failure. Unfortunately, during the autopsy, they found adult and larval forms of the nematode. This year in Australia, a 74-year-old woman presented symptoms such as mental state deterioration, fever, loss of coordination, and a suspected parasitic infection in which an antimicrobial treatment was given, but it didn't work. Postmortem findings revealed adult female nematodes in cerebrospinal fluid and brain tissue. The most recent case comes from Germany, in which a 49-year-old paper mill worker presented symptoms such as confusion, fever, and transtenoral herniation in the brain. The postmortem autopsy showed inflammation in the parenchyma with nematodes spread throughout it as well.